Okay, my name is Nomsa Mmope. I'm the Chief Director responsible for HIV and AIDS and STIs in the Gauteng Department of Health. Gauteng was the first province to roll out the ARV program, and a lot of people were put on treatment, the ARVs, and because of that people came alive, and that contributed to the increase in the life expectancy of both males and females. But to crown it all was the reduction of mother-to-child transmission of HIV, where in around 2009 we were at about 11%. And in the second quarter of this financial year, we were just under 1%. We're able to reduce HIV infection among adolescents significantly, although the girls between the ages 15 to 24, we also are like any other province. I don't think we're winning the battle that much because HIV prevalence still remains high in that age cohort. We also want to empower our patients that are HIV positive, for them to know what is it they're supposed to do when they're outside in their households, or in the community, what rights they have as patients living with HIV. And we think that it's the Legal Resource Center or the Legal Fraternity to help us with that. We are the first province to fund directly sectors of civil society. We are funding the men's sector, because we believe that it's difficult sometimes to talk to men about HIV when you are not even a man. They don't want to listen to you. But if you've got other men talking to other men about HIV infection and how they should be behaving and not bring in these patriarchal issues, we know that also can fuel the HIV epidemic. We embrace the LGBTI sector. We work very closely with them. We also are funding them to deal with LGBTI issues. We're not very conversant with LGBTI issues, and through that sector we're able to learn a lot about what it is, and there is still a lot that we still have to learn. Why we're focusing on LGBTIs is because of what we heard when we went to Melbourne, and myself and MEC, the last international conference, where we were told the LGBTI sector, sex workers and adolescents have been left behind in the fight against HIV. So we came back, and then we gave birth to PASOP, the campaign. We changed the messaging, we changed the branding of HIV, we changed the communication around HIV in Gauteng, and we think that works in our favor, because to date there are about 8 million people that we have reached through various platforms we use on the PASOP campaign. We also are working with sex workers as well. As peer educators for us, they are educating a great deal on HIV. They accept the fact that our plans are being derailed by the police. They are harassing our sex workers. They're taking condoms away from them, including the IEC material that we give. That is a big challenge for us. However, we've escalated this to our MEC, who has then talked to her counterpart about it, the Community Safety MEC, to deal with that. I would say to a teenager, life is what you make it. HIV is there, it's real. Take responsibility for your own health and engage in sexual intercourse if that's what you prefer to do. However, protect yourself from getting infected. And there are various programs that are running that teach people about preventing themselves from being infected from HIV. But the choice remains theirs, the responsibility remains theirs as young people.